Got clients with forward shoulder position and that scapular winging? Hi there, this is Dr. Evan Osar with Integrative Movement Insider. Hope you're having a great start to your week. Happy Tuesday. Today I've got three things for you. Number one, the most common cause or one of the most common causes of that scapular winging. Number two, a very simple, easy corrective exercise to help you address that anterior tilt of the scapula. Easy, not always the most easiest to carry out. However, I'll explain that here in a moment. And then finally, a very simple cue that we use most frequently with our clients to help them improve the alignment of their shoulder, decrease chronic shoulder tightness, as well as impingement, as well as just look more broad across the shoulders. So why do so many individuals have that scapular winging issue? Why do so many clients have that forward shoulder position? Well, obviously we know that most of our society spends too much time sitting, too much time on their computer, too much time on their phones, relatively speaking. Now, that's not actually the most common cause of the forward shoulder. It contributes for sure, and it perpetuates the forward shoulder. But let me give you just another common reason, and I think this even drives the forward shoulder more than the seated posture, the sedentary posture. Even though I'm not trying to discourage you from getting your clients to stand up, move around, and get away from their electronic devices. One of the most common causes of the forward shoulder is how your clients are breathing. And why I say that, you've heard me say it maybe before, and if you haven't, here's the first time. Well, one of the most important, or one of the important scapular stabilizers is also a accessory muscle to respiration. Now, if your client has an optimal breathing strategy, and we know how many of our clients have an optimal breathing strategy, and what I mean by optimal is can they access the first rib, which is right here. So if you put your fingers on your clavicle, this bone right here, the clavicle, the collarbone, if you put your fingers on this bone and go straight back, that's your first rib. And as you're touching here, this is the top, the apex of your lungs, right below the fascial covering of your upper lung area right here. That's the lung right there. That's how high they go up. Now, obviously, your lungs end up somewhere down here. That's the size of your lung when it's filled to capacity. However, we want to make sure that our clients can get their breath all the way from here at the top of their lungs all the way down to their pelvic floor, because the pelvic floor is part of the respiratory system, and you want to make sure your client can access the entire thoraco-pelvic cylinder, so that rib cage over top the pelvis. We want to make sure they access side to side. We want to make sure they access all the way around, so 360 degrees around their rib cage. So we want to make sure your clients can access three-dimensional breathing. That's how your clients should say, that's what optimal diaphragmatic breathing is. Everybody's using their diaphragm unless they have paralysis of their diaphragm and then they're on a respirator, right? So everybody's doing diaphragmatic breathing, just not everyone is doing it optimally. So back to the pectoralis minor. Pectoralis minor, if you actually stick your fingers on the front side of your shoulder, you'll find this bone right here, this bony little knob here called the coracoid process. The pectoralis minor attaches from here down to ribs 3 through 5. Well, that muscle isn't very important, and should say, it's important. It's an important scapular stabilizer because it helps to stabilize the scapula and creates a pivot point for upward rotation when you bring your arms up overhead. However, it's also an accessory muscle of breathing, because what it does is when the scapula is anchored in a good position, it will help to elevate those three ribs, ribs 3 through 5, to help expand that anterior to posterior dimension of the rib cage. Now, what if your client is not using an optimal breathing strategy? Let's say now that your client has forward shoulders. Maybe they're compressed down through the rib cage. Maybe they're compressed laterally on one side. So I'll use my left side. Say they have lateral side compression for whatever reason. Maybe overactive external obliques, overactive lat on that side, overactive erectors on that side. So what happens is now they can't breathe very well into that side. They're not using their diaphragm as well. They're not using their intercostals as well as they could be. So now that pectoralis minor starts working harder and harder. Well, any muscle that's used too much, too frequently, and or excessively, it will start to get shorter, tighter, and more active. So now that pectoralis minor, if they also have corresponding inhibition or weakness of their scapular retractors, like lower trapezius, like rhomboids, like posterior, I should say posterior delt, the lats, for example. Well, now that pectoralis minor pulls harder and harder, has a very short lever arm, so it has a very good anchor point for the scapula anteriorly, and it can start to pull that scapula into anterior tilt. So if we're not addressing our client's breathing strategy, then we need to first address that, and then secondly, train them to create more optimal stabilization strategy, and then maintain that as they go through movement. Now, I'm going to leave breathing out of this just for a moment because we've talked a lot about breathing. You've seen me discuss and Janice discuss a lot about breathing and how to create more optimal breathing across that upper thorax, which is really the key to your clients that have chronic neck issues as well as chronic shoulder issues. Now, how do we get our clients to, what's the cue we use for our clients? So you've done your myofascial release, you've done your mobilization, maybe you've already done your breathing work. Well, now we want to cue our clients, I'll move a little bit closer, we want to cue our clients to create width across the shoulder. We want them to feel as if they have space underneath their arm. We don't want them retracting. We don't want them depressing, because that will, as you can see right on my shoulder here, you see how much that will compress down. And I want you to do that with me. Put your fingers underneath your clavicle, retract and depress. And what happens is you decrease that space between the clavicle and those first few ribs. And you will also, if you keep your shoulder in that position, you will limit shoulder range of motion. So we want to cue our clients once we've done our myofascial release, our breathing training, as well as our mobilization work. We want to teach our clients how to create width. Then we want to teach them how to maintain that position as they're going through functional movements. So now I can have my client, once I cue them, hold that position, I could have them do something like a band pull apart. This is one of our favorite go-to, not our only go-to, but one of our favorite go-tos because it works so effectively. I can teach my client, okay, activate, I should say, widen, cue them to widen the shoulder, and now put a band around their arm and keep that width. So now I still have that width. I can bring my arms up, I can bring my arms down, I can even challenge through the frontal plane here, and I can challenge rotation. And again, we're challenging the individual to maintain this position. And when you let go, your client lets go of the band, if you watch me here, cue the width. Now I can do my exercises, go any direction you want. You can bring one arm to the wall, and you can do rotations. You can do many different varieties of exercises. When you let go, they should still have the width there. You shouldn't see them have to bring their shoulder back to the right position, because what you're training is a more optimal shoulder position. So that way they're learning how to use the scapular stabilizers to maintain that position. So I hope that makes sense. And then when we're doing our functional movement pattern, so we do the same things as you do, push, pull, overhead push, overhead pull. We want to teach them, cue them how to maintain that position as they go through their functional movements, as they're doing bicep curls, as they're doing tricep pushdowns. You're just retraining, I should say, re-emphasizing the same position, so that way your client maintains good alignment. From the side, they're maintaining a good alignment. If they're doing dumbbell rows, same idea. If they're doing tricep kickbacks, same idea. Keep that width across the shoulders, and that's how you help your clients with chronic shoulder tightness. Address scapular winging, as well as help those clients have chronic neck issues, especially that chronic trigger point right back here. You see the client rubbing their neck all the time. This strategy will help those clients as well. I hope it made sense. And if you've already heard this, I hope it reinforces some of the things you've already heard and helps you better explain this to your clients. Because again, a lot of what we do as health and fitness professionals is we're educating our clients. Yes, we're teaching them movement. Yes, we're teaching them exercise. Yes, we're getting them moving and empowering them. But we're also educating, I should say, and we're also educating them, making them more aware of their body, how it functions, as well as creating more optimal strategies so that way they can safely and effectively accomplish their health and fitness goals. And that's how you become that go-to person for your client and attract more individuals that need, want, and will pay you for your expertise. And if you're looking for more information, check out our anatomy of the rotator cuff. We share much more in depth about the muscles around the scapula as well as the rotator cuff. What commonly happens, this is a very common cue that we use. This is a very common strategy that happens to our clients. So this information will reinforce what's in that program. We'll teach you how to use your anatomy knowledge to assess your client, how to explain it to your clients, how to use the most effective corrective exercises to help your clients improve their shoulder, as well as start to move towards a more optimal place in their pushing and pulling patterns and the exercises that you have them doing. So check it out, the anatomy of the rotator cuff. From the Two Anatomy Geeks, my fellow anatomy geek Jill and I put together about 5 to 6 hours, closer to 6 hours of awesome information around the shoulder complex, and it'll really help you use this information. So it's not just theory, it's like, here's how you apply it to your programs. And if you're going to be in the resting area, and if not, consider joining us for this year's 2023 DCAC FitCon in Reston, Virginia. It's one of our favorite events to be at. We love the community of health and fitness professionals that come out to this event. We love the other presenters. We love getting together with Jamie and her group out there. They treat us well. Everyone has a great time. It's small. It's relatively small. There's a few hundred people there. However, it allows you to, the class sizes are small, so that way you can get hands-on and you have access to the presenters. So we look forward to seeing you there. The link is in the bio to learn more about it. And we look forward to seeing you in Reston, Virginia, if you can make it. And if not, online in Two Anatomy Geeks. This is Dr. Evan Osar with Integrative Movement Insider. Make it a great day. Continue to be that leader that your current clients need and your potential clients are looking for. Take care. And if there's any questions, feel free to reach out. Happy to help you out and happy to be that resource for you. And thank you for being part of our community. Make it a great day.